Hi everyone, welcome to this Insta Live today on hyperbaric oxygen therapy and how it can help you. Today I have a therapy that we're going to talk about with the Wellness Lab, with the lovely Jaynee Treon, and it can be potentially earth-shattering. It can be something so different. I come across a lot of different therapies all the time, and some of them are absolutely amazing. But I feel like this can almost be a new, different form of medicine without ingesting anything, without eating anything. It's oxygen. We all breathe oxygen. And we're going to have them tell us and explain to us how hyperbaric oxygen therapy can help us in so many different ways. Hello, Jaynee. Hello, Dr. Pender. How are you?
Hello. Hello. Dr. Penny, you're going to have to take the mask off.
So, my first question is, what is wellness to you?
So, wellness to me is more than being free of disease. It
Mm-hmm.
means having the health, vitality to follow your passion with compassion. I
Oh,
think that
lovely.
it also engages in the connection between the mind, body, and spirit, because every cell in our body is hearing every thought we have.
Mm-hmm.
So wellness encompasses more than just being disease free.
Beautiful. I love your line. Wellness with, what did you say? Wellness? No, passion with compassion. I love that.
Yes, yes.
Um, so can you explain to us, how does this work? How does hyperbaric oxygen therapy and the chambers work?
So in the normal atmosphere outside, we are breathing 21% oxygen, and we're relying on the blood carrying it to all the tissues in the body.
Mm-hmm.
Most of us have got compromises. Either we breathe not adequately, shallow
Mm-hmm.
breathing, sedentary life, environmental toxins. Demand for the cellular oxygen is greater than it's ever been. In the hyperbaric pressure chamber, you're getting close to 97% compared to 21%. And you're not just relying on the blood, which is almost fully saturated with oxygen in most people's cases, as long as they're healthy. We are using the pressure in the chamber to oxygenate the plasma, the lymph, the interstitial cellular spaces, the liquids in the body, the cerebral spinal fluid. They all get saturated in the hyperbaric oxygen with oxygen, and that the pressure pushes the oxygen 4 times further than the blood can. So anybody's got any microcirculation compromises, any lung compromises, sedentary life, they would benefit from the pressure of the hyperbaric oxygen. There's no other way of getting more oxygen apart from hyperbaric.
So tell me, Jaynee, why do you need the extra oxygen? Won't the body just take whatever oxygen it needs?
Yes, the body will take what it needs, but we do have a lot of demand from the modern lifestyle,
Mm-hmm.
because we have a lifestyle full of more than 30,000 new chemicals produced in the last few years, decades. There are environmental toxins. We are breathing in, we're not living in a forest how nature was supposed to be part of our lives. We're living in very urbanized living, right? So we got a lot of inflammation and highest amount of chronic disease that's ever existed. And all of that requires even more oxygen than ever before. So we know that having lack of oxygen creates a pathological signaling, and there's been Nobel Prizes given for that.
Right.
And if the tissue detects lack of oxygen at the distal area, it sets off a pathological signaling. And even last year, 2019, there were 3 Nobel laureates studying how to deal with that signaling. So we do have a greater demand for oxygen.
Okay. And how is it different? You know how sometimes in the US you see these cylinders everywhere and people taking oxygen. How is
Yeah.
your chamber different from that?
So the cylinder will oxygenate the blood because you're breathing it in. And most people's blood is fully saturated, more or less, 97% or so, thereabouts, as long as they're well. If they're not well, okay, they drop down to below 95, whatever. So it'll saturate that. But it does not drive it into the tissue in the way the hyperbaric pressure does, because that's still relying on the blood taking it to everywhere. And the hyperbaric pressure pushes it into all the other fluids, including the lymph and the plasma, which delivers oxygen where the blood is unable to.
Okay, okay. So you're saying that the blood doesn't take the oxygen to the lymph and the plasma?
Because if there are microcirculation compromises, the cellular compromises, the lung compromises, they compromise. And as we age, did you know, as we age, even over the age of 50, we age partly because there is microcirculation compromises. That's the process of aging. So that's the reason why recently Professor Shaya was able to do clinical studies to not just stop the aging, but to actually reverse the aging using just hyperbaric oxygen. But that's intense sessions, lots of sessions, and good commitment is required for that. And he has got 20,000 people.
Glowing when I met you that day.
And he has got 20,000 people on his wait list, by the way, and it's a very high price point for anti-aging purposes.
Wow.
Yes, yes.
And tell me, how typically, are there a certain number of sessions that you would say to people that come and do 4 sessions, 3 sessions, 5 sessions, before you can tell that it's beginning to make a difference to you?
It depends on individual cases and what they're coming here for. There are people who have said to me that they felt so different after one session. They had a spring in their step, they had energy, especially for the long COVID sufferers. But I never make a claim that one session is enough to move a needle. All the trials are done over lots and lots of sessions. But I would say minimum a pack of 5 sessions close together, that begins to move the needle. You see the difference. Although I've had people say to me that one session was amazing, and that's the reason they took the rest of the pack.
So the day I was there, I think you had a gentleman who was a longer COVID sufferer, and I think he'd come back after his first session that worked for him.
Yes, so most people come for the one session to try it out and they feel the benefit, and then they take a pack, because the whole process is based on cumulative accumulation of oxygen in the body, and that's where the regeneration can begin.
So, you know, when I started reading up on it and seeing the YouTube, like you were talking about Dr. Shaya, and there was another gentleman called, I think, was it Ray Chaudhary? And I mean, there's a lot that's available on
I will go to the list, yes.
Yeah, it was fascinating. So can you tell us some of the major benefits that you've seen? It just seems like it's a whole minefield. There's so much that it does.
So I've had a wide variety of clients who've come in here. My youngest client is 4 years old. He had learning difficulties. The mother was very distraught. And when she came, she was very sad because she was dealing with all variety of ways of helping him, and nothing was really working. So when she came to our clinic, she said to me, after 5 sessions, he was holding his pencil better. He was able to color between the lines. He was all very wild before. He was engaging. He had opened up. Before he was all closed in and not engaging. Vocabulary increased. So a lot of changes. Okay, so we have young clients. We have older clients. Because everybody can benefit from oxygen, right? I mean, it's a cellular. It's required for every cellular process. And when there's any injury in the body, whether it's internal or external, there's a greater demand for oxygen. So, I mean, even currently, people who are breathing with the masks, they're breathing in quite a lot of carbon dioxide, and that drops the immune system. They need more oxygen to be pushed into their tissues. So there's basically most of the symptoms benefit from having oxygen because it's required for every cellular process.
Right.
Hyperbaric oxygen enhances the potency of medicines. This can be seen very much when we look at cancer. Patients are on chemotherapy. We find that the feedback from the patients and oncologists is that in combination with hyperbaric chemotherapy is much more potent and much more successful.
It kills the bacteria in the body. It's good for macrophage, immune system, kills the bacteria, anaerobic, facultative anaerobic bacteria in the body. Very, very good for the immune system.
I should say that there are some patients who we can't give hyperbaric to. If they've had a perforated eardrum.
She was going to ask that question.
So I think that's important, because rather than giving all the advantages, we've got to make it clear that not everybody can have it. Yeah. But that is why I come into the clinic and we make sure that their ear's all right. We give take a history of their medical background, and if there's any contraindication, then we wouldn't treat. So it's for the safety of the patient and obviously for the professionalism of the clinic.
Okay. And tell me, at one point, Dr. Pender, you had mentioned cancer, I think.
Yes, right. The 1933 Houses of Parliament Act doesn't allow anyone other than oncologists to advertise or say that they treat cancer. That is law. But what we do say that hyperbaric oxygen helps the body fight the cancer. If I can try and explain, one of the things with cancer is that cancer tumors and cells thrive in a low oxygen level. Okay. And if I can try and explain, if you have a tumor or a cancer cell, immediately that happens in the body, inflammation gathers around that cell. That restricts the amount of oxygen getting to that area. And cancer tumors and cells like that moist, low oxygen environment, and it actually satiates their growth, almost like rogue cells that feed on low oxygen, but they still need feeding. So then you'll find that the cancer cells will look around the body for food. So they're looking for glucose, so we get the secondaries all over the body. In my experience, and the experience of many who have been involved in hyperbaric oxygen, as soon as the cancer cells and tumours are hit with hyperbaric oxygen, which has a bigger impact of hard oxygen, the inflammation is moved out the way and the oxygen goes right to the cells, then the cells start to shrink themselves. We will not say to be crazy to say cure, but will reduce the effect of the cancers. There's a professor and a doctor in King's with Cancer Research UK. He did a study looking at tumours in low oxygen and how massively they grew, and then when they were given more oxygen, how their growth was restricted. And that can be found on the web quite easily, is a King's College Cancer Research UK trial and research backing up just what I've said.
There's also Thomas Seyfried, Professor Thomas Seyfried. He's done a lot of work on hyperbaric oxygen and that cancer is a metabolic disease and how ketogenic diet and hyperbaric oxygen. Chris Wallums is another one. There's a lot of YouTubes they have done on this subject. So it explains in detail.
Certainly it is a great assist to help the fight, a great assist in helping the patient to fight cancer. And I think safely to say that, cures, I would not say, but it gives the patient the best chance that they can have.
It's the only protocol for radiation damage also.
Yeah, radiation. If they have radiation damage, the first line of treatment is hyperbaric oxygen.
Yeah. So then tell me something, why is it not used more? It sounds incredible. It sounds mind-blowing.
Right,
and
okay.
Not just what you're saying,
oxygen,
I read.
Right. There's no patent on oxygen, right? There's patents on lots of drugs, which means money to the drug companies.
Right.
And you'll find that a lot of the hospitals, a lot of the consultants worldwide, they're sponsored and researched with pharmaceutical companies. I'm not saying pharmacology is wrong, but what I'm saying is Oxygen is not a patent. It's sent from God, as it were, and we don't have to pay for it other than we store it and give it as a treatment, but we walk around every day breathing oxygen. I can go without food for a long time, and I probably should because I'm getting a bit heavy these days. I can do without water for a length of time. 3 minutes without oxygen and I'm on the floor, and a little longer and I won't be here.
Dr. Pender looks after children who've been deprived of oxygen at birth and were brain damaged. So he flies around the world and gives consultations to those children.
Wow.
Like autism and cerebral palsy.
Yeah.
Autism is a very complex immune system, but I've seen some amazing recoveries and improvements. Cerebral palsy is usually caused by starvation of oxygen at birth. You can never promise the parents that the child will come back to how they should be perfect.
Right.
But if you can get a 30-year-old boy who can't stand up, suddenly he's standing up and you go to the toilet and urinate on his own rather than his mum going with him and his mum helping him. That's immense.
Incredible.
That's immense. And these are the things that I've seen happening.
And what are the side effects? And in what situation should one not use it? Like you said, one was the eardrums. But
right. If you've had perforated eardrum, a collapsed lung, that's the other thing is claustrophobia, but that is something that we can manage with the patient. In 35 years, I've only had one person having to abolish treatment because they felt claustrophobic, and that was a poor military boy who had severe burns, been in a tank during the war, and the tank went in fire, and when he was in the chamber, he had a flashback. Really, claustrophobia we can handle, and we can get the patients to relax, and you'll find that the chambers are very, very spacious, and they feel very, very comfortable.
Yes, and it was glass, so you don't even feel like
that's
you're
right.
close.
That's right.
You
That's
feel like you're still part of the room.
And the doctors, Dr. Mira here and Jaynee is here. There's always somebody here, so they're never left in the room on their own. There's always somebody there, and there's intercom for speaking. So it's a very peaceful, relaxed treatment.
And what is in your 30 years of experience, Dr. Pender, what is the best recovery that you've seen using hyperbaric oxygen therapy?
Right, there's two I could mention. There is one young boy, he was 11 years of age. His mother telephoned me saying that the oncologist has just said my son's got 24 to 48 hours to live. Okay. Can you bring an oxygen chamber into the hospital for him? I've heard about what you're doing with children. And I said, oh, I would love to do that, but yeah, it could be done, but the red tape is going to take 6 months. As simple as that. If it was my son, and he was given 24 to 48 hours to live, I would bring him home to die in my own home. If you do that and you've got him out, then we'll arrange to get him hyperbaric oxygen.
And you were able to recover him?
And we got him back. 11 o'clock that night, he was taken out of the hospital. 2 o'clock in the morning, we started oxygen. And then over the period of a year, a very generous businessman in London donated a chamber for him to be installed in his home, and I supervised the treatment. That young boy is now back at school. That was 4 years ago.
Oh my God!
He had a brain tumor and a spinal tumor, and he's totally recovered. And I've got photographs to show you that. Yeah.
Oh my God! What an amazing story.
Yeah, absolutely amazing. And then the other one was a woman who had fibromyalgia, couldn't get out of her bed. For 3 years, just getting to the bathroom and back was all that she could manage. Eventually, her husband persuaded her to get hyperbaric. We got a private ambulance, brought her to the clinic. and within 3 months, she's walking on the beach, and her marriage is back in place, and she thought her life had come back again. Yeah.
Wow, wow.
Just thank the oxygen, not to me, not to the chambers, but just the power of oxygen.
I know, amazing.
Okay.
But that also makes me think, I mean, what Jaynee, what you and what you're doing, Dr. Pender, is incredible. Is, you know, our aim is to empower people with health and wellness. With that in mind, what advice do you have for the people who are going to listen to our chat?
I think the first thing is important for a general thing. Worry and stress causes so many illnesses. And my advice before you come to any doctor or anyone, get a mentor, get somebody close to you, and if there's something bothering you, talk. Get it off your heart, off your shoulders. Doing that before you have any treatment is so important. That's my advice. Not promoting hyperbaric, not promoting pharmaceuticals. Get a friend and start talking. Marriages break down because there's no talk. Families break up because there's no talk. People commit suicide because they harbour everything into themselves. My advice is open out, get a mentor, get a friend, get somebody around you. Don't face life on your own.
I would say something extra. I would say that get in touch with nature. Go into the sunshine, hug a tree, earth yourself, see the connection between mind, body, and spirit, and go for everything that's natural to boost your immune system. That's where you start, I think.
Right. That's lovely. Now, while we're waiting for questions from the audience, I have a few that were sent in to me. So someone was asking about how can you use hyperbaric for beauty and for skin?
It's very good for the skin elasticity and collagen.
Okay.
Because the wrinkles are formed with the lack of microcirculation, and if you're pushing microcirculation to the periphery area, you get pink cheeks.
Oh, right. Okay. So you're saying that even for
you stop the oxygen getting to your skin and you get gangrene.
Sorry, he's saying that if you stop the oxygen reaching to the skin, you get gangrene.
Yes, as he told us, absolutely.
Yeah. But there are many stages before that. Yes. Yeah.
Okay. And in terms of if someone, like you were saying, that if someone is just coming for maintenance or to get to optimum health, you would recommend once in 2 months? No, did you say
I would say twice a month.
Twice a month.
Yeah.
And can you overdo this? Is there a limit where you would say, okay, no, you should not be coming anymore?
40 sessions, I'd say you need 40 sessions before you think you need a break.
It depends what you're treating. Treating. If you've got osteomyelitis of the bone, there's infection in the bone. Sometimes you go into 60 treatments, and every different clinical condition, there are different pressures for different illnesses. It depends what you do. How if you go into your doctor, he will give you a prescription for an antibiotic at various strengths. It's the same with the hyperbaric. The pressure determines how deep and how quickly the oxygen reaches every part of the body. So it depends what we're treating that we decide that.
Most of the clinical studies are done 5 days a week, 40 sessions on two double atmospheric pressure. So quite intense. So I would say get certain amount of session in close together and then think about top-ups.
Yeah, on memory, anything neurological, you tend to go 1.5 to 1.7 bar. The studies show that is most effective.
Very good for the brain fog, very good for the memory, very good for multitasking and mental sharpness.
I have seen an 89-year-old gentleman, his memory recovering. Wow. He had quite severe Alzheimer's, and it wasn't perfect, but he remembered what bus stop to come off. Where he came with his partner, and when he came near the bus stop to come to the clinic, he would say, "It's the next stop," and his memory started coming back,
This is the Alzheimer's person.
Yeah, that was
Right.
amazing. That was amazing. And he was treated at 1.6 bar.
So basically, I think everyone needs to at least try one session.
Yes,
See
yes,
how it
yes.
works for them. Yes.
Yes.
That was
But
lovely.
most people try one session first and then they book a package. Yes.
Yes. So, and Jane, just the last thing, will you explain the process? How does it work when someone comes to you? Will they
I'm
tell
going to show you I'll show you the clinic and I'll show you what the chamber looks like. I'll just turn the camera around. So this is what the clinic looks like.
Yes, I can see them. Yes.
Right?
Mm-hmm.
That's the clinic. So that's the chamber. So so when the people come in, they fill in a form to have give me a little indication about what they're suffering from, what their conditions are, and what are the precautions I must take in terms of how slowly I must go in the pressure in the chamber. So if they're particularly sensitive to flying, the ears don't pop easily, then you go very, very slowly because it's a mono chamber. We go at the pace of the client. So it's completely, you're in your own space, it's sterilized, and you can listen to music, you can read a book, and it's spacious, quite spacious. And so I just want to know how slowly I must progress. There's Dr. Mira, she's got 7 years GP experience. So she also is very sensitive to and keeps an eye on with the intercom, how you feeling, and then we gradually go up in pressure. And then if anybody's got a complex problem, Dr. Pender comes in and he has a look, examines the ear, looks at the chest, any problems, any indicators why you shouldn't authorize maybe slightly higher pressure. And that's the process. So minimum sessions usually an hour long. And some people come in for 90 minutes. 90 minutes is a good protocol because then when you go up and down a little bit, you release even more stem cells. So you need longer time to do these things. So that's it. It's very easy. Everybody who's come here has loved it, because 90% of my clients are recurring clients. They've done 10 sessions, they saw the benefit, they do another 10 sessions, and they see the benefit more, and then they read about Professor Shaya Frati's anti-aging, and then I've had athletes, I'm a preferred supplier to British Athletic Association, and there's some athletes who've come with a broken ankle or something like that, and they've tried to find a quick way of recovering, and they've tried the hospital, because there are some hospitals that do have hyperbaric oxygen chambers. Whips Cross is the nearest one to London, but because it's FDA approved drug for about 14, 15 conditions, and these are the ones that the drugs don't manage well. So he said he got in contact with the Whips Cross. May I come in? I need to repair my ankle quickly to take part in competition. And they said, no, you're not within that category, so we can't help you. So he had to come into us, and I said to him, 2-hour sessions, or Dr. Pender was here. He prescribed 20 days of 2-hour sessions. He was repaired, and he could take part in competition.
Wow.
Yes. Wow. And he would have taken longer. He would have taken many months.
Fabulous.
I see people suffering with the problems and they live with it. You know, we get used to the suffering. We get used to the problem. We think that's natural process, but we have options now.
A lot of professional football clubs, Premier League clubs, use hyperbaric for recovery of injuries, and I've treated players for most of the Premier League football clubs. Top stars and famous stars. Because of my patients, I will never give names, but they come in, they get treated, and they recover quickly.
That's fantastic.
You know, Djokovic, lot of celebrities and a lot of sportsmen, they all use this. Djokovic has got exact same chamber. There are a lot of Justin Bieber, a lot of these people.
I didn't mention his name. I didn't mention him, but I look after him when he's in London.
Yes. There are a lot of people who are using it in their homes even. So but it's expensive to buy for your home.
One quick question before we go off. Is it safe for people with low blood pressure?
Yes.
It is. Okay.
It is. Yeah.
Fabulous. Thank you so much. Thank you, Jaynee, and thank you, Dr.
Thank you.